Good morning, everybody. Happy Monday. Hope everybody had a great weekend. This is the Anchorage Emergency Operations Center update for April 26th. Folks, just a quick reminder, we got Vaccine Week coming up, and this is a flyer for the May 1st Alaska kickoff of Asian Pacific Islander Month. And this is the event that we're co-hosting with Maltosi and friends over at the Northway Mall. So this is the newest flyer that's coming out.
Good morning. This is Luke, Aura Situation Unit Leader here in the EOC. And locally, up 47 cases, 0 deaths, and 9 hospitalizations. For 213 resource requests, we've filled or otherwise satisfied 1,736. That's an additional 4 since the last report, with 17 currently open and working. It's 64 non-critical transports in the last 72 hours, with 1 after hours in the last 24. In the congregate sheltering sites, there are 411 clients, down 13. In the non-congregate sites, there are 288 clients, down 21. That's 699 clients in all shelters, down 34, averaging 2,097 meals served per day. Over the weekend, at the Visit Healthcare testing sites, there were 1,165 sample collections performed, averaging 53 per hour. And in the last 7 days, 4,690 sample collections performed. For our vaccine numbers at the Visit Healthcare vaccine sites, since the last report, at Dempsey, 90 doses, at the blood bank, 95 doses, Shiloh Baptist Church, 54 doses, Diamond Center, 97 doses, Northway Mall, 78 doses, and Visit Mobile, 12 doses. End report.
Weather.
Good morning, everyone. Michael Cutts from the National Weather Service office out at Sand Lake. Well, it looks like our run in the sun is going to be coming to an end towards the end of the week as a surface feature moves in from the southeast and brings us some more clouds and chances for rain all the way through next weekend. Looking at some breezy conditions along Turnagain Arm for Tuesday and Wednesday, and otherwise a fairly nice week. That concludes my briefing. Any questions?
Operations.
Hey, good morning. This is Joe Calvig, EOC Operations Section Chief. Our mass care branch, QNI, has 5 projected discharges through Wednesday and 0 projected today. Our warming tent had 27 people over the last 24-hour period. Visit Healthcare testing had a decrease of 13% over the previous week. The 7-day rolling positivity rate average is 2.54 as of Friday, April 22nd. The 14-day average reproductive rate is 0.925, and the 14-day average case rate is 17.18 per 100,000 population. For testing this week, our pop-up testing, we have May 1st at Muldoon Elementary School from 08 to 5 p.m. or 7 p.m., excuse me. Medical countermeasures. If you've seen in the news, Johnson & Johnson vaccine pause has been lifted, and the vaccine week starts May 1st, finalizing pop-up locations for clinics that week that we will share broadly. So far, we have pop-ups in Girdwood, Eagle River, Midtown Mall parking lot, and more to come as we continue to plan. Alaska Airlines Center will hold regular clinics Monday, Wednesday, and Friday from 8 a.m. to 12 p.m., offering all vaccine types. End of report.
Logistics.
Hey, good morning. It's Scott Carpenter with EOC Logistics. We have another busy week ahead of us with mass care support. We continue to work the modifications for the summer operations with non-congregate shelter sites and the wraparound of services to support that. In the medical countermeasures, we continue to work the various sites to include the vaccine week requirements and pop-up sites. For the rest of the EOC and AHD support, we have some personnel onboarding today. We'll also continue to work transition planning as well as event planning. Pending any questions, that concludes logistics.
Thank you, Scott. Finance.
Good morning. This is Carrie Wiedeker, the EOC Finance Section Chief reporting. Currently, the EOC has encumbered $18,692,919. Our actual spent to date is $49,143,587 for a total of $67,836,506. Please continue submitting any invoices and supporting documentation to EOC invoices at anchoragek.gov. The Office of Emergency Management continues to seek cost recovery in the form of FEMA public assistance. For any information about that, please contact Aaron Zachary. End of report.
Thank you, Carrie. Safety.
Good morning, this is Annalisa Roberts. So they are effective, and while no vaccine is 100% effective against protecting the disease that they're given it for, they are still recommending that everybody gets a COVID vaccine as soon as one is available. But they still recommend that fully vaccinated people continue to take steps to protect themselves and others in many situations, like wearing a mask, maintaining the appropriate social distance from others, and avoiding crowds in poorly ventilated spaces, and washing their hands often. End report.
Moving along, public information.
Good morning. This is EOC Deputy Public Information Officer Heather Arono. We are working on promoting the May 1st kickoff event that was mentioned earlier. Very excited about this. Working on gathering materials and resources. We're going to have a booth for the EOC at the May 1st event, and also ordering banners and signage for our mobile vaccination units that will be out for some late night vaccination clinics during that week. We are collaborating with the Mayor's Office on an upcoming Humans of Anchorage project, and monitoring and sharing messaging on the the J&J vaccine being moved back into rotation. We are taking a look at preparing for when the vaccination for Pfizer might become available for a younger age bracket. And as always, continuing our outreach to our key influencers and leaders in the community to make sure that we are making information as accessible as possible. Barring questions, end of report.
Thank you, Heather. Liaison.
Good morning. This is Celeste Prescott, Liaison Officer for the Anchorage EOC. I'd like to thank all our partners that were able to join us. Do we have any cooperators that would like to report out today? Okay, hearing none, we'll move right into the hospitals. And is Kirsten on for Alaska Native Medical Center?
Good morning, this is Kirsten at ANMC. This morning we have 2 positives. Of those, 1 is in the ICU. Neither are vented. 0 PUIs, and ANMC has closed this operational period for our incident command. End of report.
All right, thank you very much, Kirsten. And I know the 673rd Medical Group were unable to join us, but they did send in their updated vaccine numbers. And currently they have 8,430 first doses, 6,854 are fully vaccinated, for a total of 15,284 shots. And Matsu Regional Medical Center was also not able to join us, but they currently have 10 positive cases, 6 are in the ICU, 4 on ventilators, and 1 person under investigation, which is also in the ICU. And that's all for Liaison. Thank you.
Anchorage Health Department.
Good morning, everyone. Kelly Biasock with the Anchorage Health Department. So we will have published our health metrics briefing later today on the Muni site, so we encourage you to take a look at that. The overall Anchorage risk level has dropped slightly again this week and is now in the upper part of the considerable risk category, as you see on the slide. All risk metrics saw some reduction in risk level this week. Daily new cases decreased this week, but still remain high. Current and projected healthcare capacity are both in the lower risk category, as is testing. As expected, with reduced case counts, transmission risk is also decreased, although it remains in the considerable risk category. And the current 14-day rolling daily average is 18.12 cases per 100,000, which is an 18% decrease from last week. While vaccination coverage continues to increase, hundreds of appointments remain available daily. That's a concern to us. Approximately 54.1% of the Anchorage residents 16 and older have received at least 1 vaccine dose, and 45.9% have completed the series, and that those numbers are as of Friday. So the lack of demand for the 2-dose vaccines and number of people missing appointments is concerning. So we definitely encourage everybody over 16 years and older living or working in Alaska to get the vaccine. So please spread the word. And in addition, with a lot of people traveling right now, we still do recommend that people that return from out-of-state travel get tested. And that is all for me today. Thank you.
Thank you, Kelly. And Incident Command.
Good morning. This is Incident Commander Bob Dole. Those numbers from the hospitals, although those numbers are low, it says there are some folks that are still really struggling with the effects of COVID. So our battle against this virus must continue and is still very much alive. I think the other thing we know about COVID is the one constant is change. It was a relief to see the Johnson & Johnson vaccine getting cleared on Friday to resume use of that. I understand tomorrow there will be some revised outdoor masking guidelines coming out from the federal level too. So one of the things we should be careful about is expectation error, or thinking we know something because we knew something a month or 2 months ago. The one constant is change, and we need to think about that as we continue to battle COVID. End of report. Thank you.
All right, thank you, Bob. And then a bit of a announcement. We did our new IAP was sent out last week, and part of that we've changed our sit rep distribution from daily to twice a week. So that'll be on Tuesdays and Thursdays. We'll be sending that out. All the information can still be found online. We just wanted to make sure you're not missing it. So thanks everybody for participating, and we'll see you all on Thursday, the 29th at 10 a.m. Thanks everybody.